The Gauteng Health Department says it's concerned by the spread of malaria in the province. To date, at least 10 people have died and over 1,000 cases have been recorded. The department says many of the people traveled abroad to countries including Angola, Zimbabwe and Mozambique. Let's unpack this further. We're joined this morning by Tebogo Matjokotja, who is with Gauteng Health. Tebogo, it's great to talk to you. Thanks very much indeed for coming on. 10 deaths insofar as malaria is concerned, and that is for the period essentially from the beginning of the year to September, right? Is that out of bounds insofar as what we've experienced before?
No, definitely not, Michelle, and good morning and to the viewers at home. Definitely not. So we are having a lot of cases that we are reporting every year, and also the death. So these are the similar trends that we have seen in the past year, especially more specific in 2022.
Mm-hmm. So I suppose yes, that's also not good, right? If the trends are staying the same year on year and they're not getting better, what does that mean about our interventions?
We are doing what we can, our best, Michelle, because we must remember that Gauteng is not endemic, meaning that we do not have a parasite that really aches for malaria. Mm-hmm. But for us to control malaria, we are depending on other provinces such as Mpumalanga, Limpopo, and our SADC countries as well. So we are most relying on them to eliminate their malaria. So if they have not eliminated malaria, for Gauteng will still experience a lot of cases because of the economy as well. So with the interventions that we are doing at the moment, we are having like health promotion, where we are educating people, especially during the festive season. As people are going home, you'll see us at the bus stations, we are at the taxi ranks. We are also trying to educate people what precaution measures they should take as they are embarking to these endemic areas. Mm-hmm. And we are also making availability of our prophylaxis, which people can access at our facilities, in our public health facilities, which are free of charge. Of course, there are those ones that you can buy from the chemist at a fee, and also just to tell people how they could protect themselves once they reach the endemic areas.
Okay, so can you just break it down for us, Tebogo? If I know I'm traveling to Angola, Zimbabwe, Mozambique, those areas that are malaria endemic, what do I need to do to keep myself safe? And you've already mentioned the prophylaxis, which is freely available over the counter.
Yes. Not over the counter, but in our public health facilities.
I see.
So you can go to one of our clinics. Yes, I just want to rectify that. It's called the doxycycline. So doxycycline is free of charge. You should take it a day before you leave, you enter into an endemic area. While you are there at the endemic area, you should be taking that on a daily basis. And when you come back from places like Gauteng, where it's non-endemic, you have to continue with the medication for 30 days.
Wow.
Yes, this differs. And then for melanin, the one that we are saying you're going to pay it at the Discam and some of the pharmacies that you are having, you are taking it a day before, taking it while you are there, and 7 days when you come back. So it is shorter than our doxycycline.
What was the second one that you mentioned, Tebogo?
Melanin or Mozitec.
And these are both prophylaxis?
These are both prophylaxis. It's just that our Mozitec and Melanin are quite expensive.
I see. So the one that is more affordable is the one that you have to take for 30 days when you return from your trip.
That's correct.
And do you find, Tebogo, in your experience, that people are taking these measures when they indeed are traveling to those areas?
To tell you the honest fact, Michelle, people are not really taking malaria serious. I think if you have not seen a patient who was sick from malaria, I think we are also underestimating it. For instance, there are people who go to Limpopo, not only Mozambique, Mpumalanga, KwaZulu-Natal, and there are places that we see that mostly they are parasites that really lead malaria, and malaria is quite high. Mm. And when you see people, they don't take precaution measures. And simple thing is, if you have missed taking the doxycycline or prophylaxis, you must make sure that measures are being taken, like you can also apply your mosquito repellent while you are there at the endemic area, and make sure that you are wearing long sleeves during the night, and you avoid being at night, outside at night, especially during this peak period.
Yeah, absolutely.
So to answer you, people are not really complying.
And you mentioned in that answer as well that you think it's because people have never seen a malaria patient. Can you describe the illness to us?
Okay, so malaria, the incubation period, like when you come back, you are bitten by malaria. It takes like 10 to 15 days before you start showing some symptoms, which is fever, you are feverish, there are chills, you are having headache, sometimes the dry cough. Hence, during COVID, we're missing a lot of cases because the very signs and symptoms, they are being exhibited in some of the diseases that we are seeing on a daily basis. So especially in non-endemic areas, that can be missed because they are the same as other diseases. But these are the signs that the people should look at for when they are from the endemic areas. And the other thing, Michelle, that I want to mention is people are not honest when they come to our health facilities. If you know you have visited the endemic areas, please do tell us your travel history. In so doing, it will make sure that the diagnosis is speed up and also a treatment is initiated earlier.
Yeah, absolutely. Easy enough to get that treatment from your nearest clinic, but the symptoms are so very similar to flu that they are also very easy to miss, Tebogo, and yet you can die.
Yes, you can. You can die. That's why we are emphasizing the issue of travel history. People, they don't want to be transparent and truthful where they come from. So that's why in some of the cases, you might miss it, or the treatment might be initiated late because of those information that was not communicated.
I'm reading some information just in preparing for our interview around a malaria vaccine. Tedros Ghebreyesus from the WHO saying he's quite excited that we now have 2 malaria vaccines that are available for those endemic areas. I mean, are we a far way off of including vaccines in our course of treatment here?
Yes, we are still very far off from doing that, but anything can change. I mean, if really we are seeing a lot of death, and no one should die of malaria, especially if we know that this is curable and is treatable. So I think at some stage, WHO, if we are not really eliminating, because now they are targeting some endemic countries. These are some SADC countries where they are seeing a high volume of cases. So the theory behind is if they are treating them that side, then South Africa will be seeing lesser and lesser number of cases. So at this stage, for South Africa, we are not considered for the vaccine.
Right. So the answer to this conundrum for us here in South Africa to try and get people to take precautions and to get treatment early can only be education and raising awareness.
That's correct. Gauteng, especially Gauteng, that's the only thing that we can do. We are regarded as preventative, so those are the preventative measures that we are taking as the province. And the other thing is, because of the countries that we've already mentioned, we are also collaborating with other people, such as Doctors Without Borders, where we also, our IEC material, we have translated into Portuguese. We are trying also to really reach out the people that cannot understand English and any other languages that are spoken in South Africa.
Yeah, incredibly important story this, and this is why interviews like this, discussions like this are important as well to try and also increase awareness. Tebogo Matjokotja is with Gauteng Health. Thanks so much for joining us this morning. So that is the advice. If you are traveling to known malaria endemic areas, and that includes Angola, Zimbabwe, Mozambique, but also Limpopo and Mpumalanga as well, you do need to make sure that you take those prophylaxis the day before you travel, while you're in that part of the country or in another country, and then, depending on the course of treatment, you're taking for 30 days when you return back home. If you are traveling, probably best to just read up on the necessary measures you need to be taking.